In this video, I'm going to show you how to get rid of knee pain with your own anatomy using 3 key steps. Come up into standing and follow along. This is embodiment, and the embodiment system is called the Franklin Method of Imagery. The number 1 most important anatomy step to get rid of knee pain is to know exactly where your hip joints are so that you can have your hip joint move opposite from your knee. The number 1 cause of knee pain is not knowing where your hip joint is, not moving your hip joint in the way that's ideal for your hip joint, and that puts pressure on your knee. Here's how you find your hip joint. Touch your pubic symphysis, the bone in the front, and go to the side. And you'll be at the hip crease, and there is your hip joint. So bend and straighten your knees, and notice, do your hips go back when you bend? If your hips go back, the top of the thigh bone, this is called the femur, if the top of the thigh bone goes back, the bottom, which is the knee, glides forward. Notice when you bend, is this happening? Now, bend and keep your hips forward, and you'll feel how that puts more pressure in your knees. Don't do that. Bend and let your hips go back and feel how your knees go forward. That is number 1. Next, the number 2 aspect to feel in your leg to get rid of knee pain. Touch your thigh bones and drag your fingers down, 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 down until you run into bone. The bone that you run into is the end of your thigh bone. And bend and straighten and feel the movement that happens there at the end of the thigh bone as you bend and straighten. Stand up. Let your arms hang down. Breathe. Bring your fingers back along your thighs. Find the bottom of the femur and bend and straighten again and feel that movement of the bottom of the femur gliding forward as your hips glide back. The bottom of the femur gliding forward as your hips glide back. But it doesn't just glide forward, it has a rotation. The rotation is step number 2 of how you use your anatomy to get rid of knee pain. Your thumb is on the inner part of your femur, your thigh bone, and your fingers are on the outer part. Notice when you bend, that there's a rotation. So we'll use imagery to figure out how it moves. So first picture that your thumb comes a little more forward and the fingers go a little more back when you bend, and when you straighten, the thumb moves a little more back and the fingers come a little more forward. So we call that external rotation on the bend, internal rotation as you rise up. External rotation on the bend, internal rotation as you rise up. Let your arms shake out, stand up for a moment, breathe. And now we're going to do the opposite. And the reason we're doing the opposite is to see, does it make it easier for you to feel the difference? Because if you can feel something, then you have a choice. And when we can't really feel, it's all foggy. Now we'll picture the opposite. Fingers back on the edge of the thigh bone. Picture now the fingers on the outside move more forward and the thumb doesn't move as far forward, and when you rise up, the thumb side comes forward and the fingers go back. And one more time, try to picture that the outer part of the thigh bone comes forward when you bend and the outer part of the thigh bone moves back when you rise up. Let your arms shake out. Whew, that is so hard for me to say, and it's hard to do because that's not how it works. And so feel the difference. Your knees will probably feel less good right now. So we're going to do it the correct way. So bring your fingers back on the bones, and when you bend, the thumb side moves more forward and then moves more back. The thumb side moves more forward and moves more back. Last time, thumb side moves more forward, moves more back. Come up into standing. Bend and straighten. And notice how your knees feel. You have now completed step number 2, picturing the rotation of the thigh bone at the knee. Heals knee pain. Just picturing how something works in your body helps it to work better. When your body works better, pain disappears. Post in the comments below what you notice from doing these first 2 steps. Step number 3 for how to get rid of knee pain using your own anatomy is to walk. First, let your legs swing from the very narrow location of your hip joints. Walk and let the legs swing. Now that you're used to walking and letting the legs swing, allow your lower leg to swing on your upper leg as you walk. A very common habit is to push our legs, to push the legs from the back, to tighten the leg muscles as you walk. Instead, practice letting your femur, your thigh bone, swing from your hip socket, and let your lower leg, your tibia, swing around your knee. Notice how your knees feel as you walk, allowing the bones to swing, and then change it. Change it to tighten everything up to how you walked before you did this small but powerful embodiment lesson, and feel the difference in your knees when you walk, pushing your legs versus allowing them to swing. And then let that go. Shake that out. Touch your hip joint area. Let the hips go back and the knees go forward. Let everything be loose and walk again. Letting your thigh bone swing from your pelvis and your lower leg swing from your upper leg. And you have now completed all 3 steps of how to use your anatomy to heal knee pain. Be sure you comment on what you notice. I have 2 other videos on my channel which really help with knee pain. One is to get rid of meniscus pain, and the other one is a more detailed embodiment of the hip joints, which will help you with your back and especially with your knees. Hit the subscribe button so you get more pain-free movement tips.